Hello, Joe. Welcome to LMTV.
Thank you.
Oh,
I'm excited. It's my first time on LMTV. You guys
okay.
are doing a great job.
Thank you. Thank you. When we are thankful that you opened your doors to us. We are currently running a show that we want to find out what's going on in other countries as to how the
Okay.
COVID-19 is the condition of the COVID-19. Uh, we will go straight away and not take much of your time. Well,
Mm.
we just saw on the NHS platform that you are supposed to stay home, cook, blah blah blah, and all that. So, which of them are you doing to keep yourself occupied?
I've become a teacher. If
Oh.
anything, I've I've become a teacher. I've become a chef. A bit of everything. It's challenging, but we're getting through it. Yes, the NHS measures that have been put in place, we're all trying to adhere to it. I'm an NHS worker myself, so it's really important that the information that we are echoing out there, everybody actually sticks to it. By doing that, we are hoping to be on top of this pandemic issue.
Oh, that's nice.
Yeah.
So, would you tell us your name, where you are based at the moment?
Of course. So my name is Josephina. Everybody calls me Joe. I am currently living in London, which is part of the UK, one of the main capital town. I'm a qualified nurse working with the NHS. Fortunately or unfortunately, I'm actually on maternity leave not too long ago. So I have sort of escaped from the craziness or the chaos of what is happening, which in some ways I feel quite sad about because I'm not able to help my fellow colleagues the way I would like to. But at the same time, looking at the way things are going, I also have to think about my family.
Exactly.
Because there's so many of us that have to leave the comfort of their own homes. Some will go to work and not be able to come back home because they are scared that they are maybe going to catch the virus and end up actually giving it to their family members. So therefore, they end up staying in hotels, staying in B&Bs, other forms of accommodation, in order to be able to protect their own family, which is very sad. I don't know how I would feel to have put myself in that, have to be in that situation. So I'm lucky, but at the same time, I'm not, because I love my job as a nurse. But at the same time, at this moment in time, especially now having a newborn, I have to be very cautious. So when they called for those to come back, I don't know if some of you know, the government called for some of us to come back, whether you're retired or you've just come out of the NHS, to come back to actually do some work because the numbers of us was dropping. So that I wasn't able to actually lift my hand up and say that I will be one of those that will go back to work to be able to support the good cause. So I'm just supporting my colleagues in prayer, and hoping that the measures that we are asking, which is to stay at home and stay safe, and plenty of hand washing. We've gone through so many steps with others of how to wash your hands effectively. So we're just hoping that people actually adhere to that instructions.
Oh, well, that's nice to hear. And well, I think that's one thing that differentiates a nurse from a nurse. The one who does it with love and the one who does it for the income. Well,
Yeah.
yeah. So right now,
I do love my job as a nurse, but like it really saddens me that I'm not able to support them at this moment in time.
yeah,
But there's a reason for that. Which
yeah,
I've
exactly.
explained.
Sure, that's true. Yeah, so how is the prime minister and the frontliners who were affected by this pandemic? How are they
Okay.
doing?
Well, I don't know if some of you heard, but our prime minister was actually affected with the coronavirus. And funny enough, he was actually admitted in the hospital that I actually work at, which is
Oh.
St. Thomas. Guys and St. Thomas. So I had a few colleagues that were actually in there, and I kept on asking, how is he doing? How is he coping? So God's so good. He's been able to come out of it. He's actually now, I think, coming back to work. So he had some couple of days to have respite when he actually came out. Like I said, God's so good. He's doing well. And he's just continuously echoing on. So I don't know whether you guys are aware of the measures that the UK has also put in place. So for the past 3 weeks plus, we've been under what we call lockdown.
We experiencing a similar one here back here
of
in
course,
Ghana.
yes, excellent, yeah. So we've been locked down for 3 weeks, going into 4 weeks now. We were hoping that the lockdown would be lifted a little bit, but the government has decided to prolong it to a further 3 weeks. That's mostly because a lot of us, unfortunately, is not actually following the instructions that the government has put in place, which is to obviously stay at home. We should not go out unless it is essential. So for essential, if it's, for example, you need a bit of exercises, you can go for a short time. Yeah, and if you're going to go out for that short time, you need to be with a family member. And then also the social distancing at the moment is set at 2 meters. Some of us are adhering to it, others are not. Even when we go shopping, what we found is before we can just walk into the market, the supermarkets, we can just walk in and get our groceries. Yeah. What we have found now, they have actually lined up the 2 meters where we also have to be following instructions. Wow. And also then until you are given the go-ahead to go into the store, you have to wait. So there's some strict measures that are being put in place. Some people are adhering to it, others are not. So due to that, our numbers, unfortunately, is not dropping as much as it should be. If we all were to listen to the government's instructions, we would have maybe possibly seen a bigger drop in our numbers, but people are not listening. If I can further go on, not too long ago, there was a report of people, actually, because the weather was very nice. If you guys are aware, we get cold weather all the time. We are very cold. So when the sun comes out, we get excited. A lot of us get excited. And what happened was a lot of us came out. That's excluding me and my family, by the way. a lot of people went outside. They were barbecuing. There was sunbathing and so forth.
I missed all of the COVID stuff.
Amongst all this COVID-19 issue that's still going on, some people they were not taking it seriously. Basically, people are still not taking it very seriously.
So would you agree with your Prime Minister when he says that easing the lockdown isn't too good for your country at the moment?
I believe that it's way too early. I still think it's way too early, even though it's very frustrating being indoors and everything. It's for our own good. It's definitely for our own good. People will be saying, "No, because you're a nurse, that's what you're saying." That yes, it's very true. It is because I'm a nurse, that's what I'm saying. But it's also for our own safety. We need to be able to follow these instructions in order to be able to get our numbers down. I totally agree with him that it's a bit too early.
Well, as at the first time I started following, I think your number was about 1,950 with about 60 deaths or something. And right now, what's the current condition? How is it? How bad is it gotten?
Our deaths is what we've all been listening to at the moment, and it's ridiculously high. And it's at the moment it's at 16,060.
Wow.
Yeah, which is extremely scary. So that's why it's so important to be following these instructions. Stay home and stay safe. Stay home, stay safe. And that's the only way we're going to keep our NHS running. And people are not listening to those instructions. So yeah, we are 16,060 in terms of death at the moment. The recorded numbers, unfortunately, has skipped out of my head. But for me, the death is more scary.
And what of the recoveries? Are they in the recoveries?
This is the funny thing at the moment. For some reason, we are hearing in the news of those recovering and so forth. But unfortunately, they're not giving us the numbers of those that have recovered, which I found to be quite sad, personally, because it seems like as though all we're hearing is the negative part. We occasionally see people, coming out. I don't know if you guys heard, there was a 100-year-old lady. Yes, I'm going to call her a lady because she's strong. Yeah. A 100-year-old lady who actually survived the COVID-19.
But don't you think it's for a good reason? Because say that we get to know, we as human, when we get to see the brighter side, we tend to forget the darker side. So when we get to know that the recovery is not as risky as they are saying, I could recover. There's a possibility I might so, because I think it's not just in the UK, is I think worldwide. The recovery, the announcement of the recovery is quite in a slack as compared to the number of people affected. So don't you think that is for our own safety?
But then it is for I totally get you from where you're coming from, but at the same time I believe that it would be good to also give us an update of those who are also recovering. so then you can tell that the deaths is way higher than the recovery rate. So then we also push on the fact that if the more we stay at home and follow the government's instructions, then it can change. The numbers can possibly change. You understand? Because right now we've got so much deaths going on that people are dying from this COVID-19, and because of that, of us not listening, the numbers of people actually surviving this is also very small. But we want to change it around. Do you understand where I'm coming from?
Yeah.
If we do the same thing, then it's a bit encouraging also if we hear a bit of recovery numbers.
But the NHS has it on their site. It has a mental something that psychs people to be more relaxed as compared to them hearing or being relieved as a result of knowing that people are recovering.
Right. You are right. You're right in that as well. But I guess so when you hear such people number dying, but I think for also from a nurse's perspective, it's like as though we're not doing anything right. All you're recovering is the death. People are dying. And then another thing is mostly because people are also dying because nurses are not also getting the right equipment to be able to look after them. The PPEs, which I'm sure you've heard about as well, they're not able to get the right equipment. So that's even more reason for people to stay in, so that our numbers can also go up. And then hopefully once we get the right equipment in, we'll be able to do our work effectively.
Does it scare you as a nurse when you hear the whole issue with the COVID-19? Does it scare you?
Oh yes, definitely. It scares me. And not too long ago, even one of my own friend, my childhood friend, had the coronavirus with her dad, and they both actually admitted into hospital. And it scared me as a nurse that, even one of my fellow friends can be in that situation. It was so close to home for me. As a nurse, even forget about COVID-19. Having to look after a patient that's infected alone is scary. And that sometimes we only get it once in a while in the ward I used to work on. But now the ward I used to work on, which was a women's health ward, has now been turned into a COVID-19 ward. So it's no longer taking just the general women's health related patients only. We're only taking COVID-19 patients. And it's very scary. We're not fully equipped to be able to look after such patients. Do you understand? So in order to be able to bring all these sorts of other patients in, it's very scary. It's extremely scary.
In Ghana, the president or the government is absorbing some of the bills.
Right.
And yes. Is there a social intervention or financial intervention? Has there been any of such interventions in the UK?
They have they've tried very well to be able to support small businesses by giving them a subsidy of like 80% help for them to be able to continue to hold on to their employees. So for those who have quite a big number of employees, they want to say 80%, they'll pay them up to 2,500. So they put in measures in place. There's also what we've got other things that they have put in place to be able to support those who may be struggling at this moment in time. Unfortunately, it's just those who are self-employed, especially when they haven't started their self-employment too long ago. Unfortunately, then the help is not being actually pushed out towards them. So there's a lot of people are struggling financially. So they are still working on it. They are mentioning big numbers, which we don't know how that is going to actually work. But we are hopeful and hoping that this thing will come down very soon and people will be able to go back to work. Not too long ago, we just heard that even Virgin planes and the trains, it's likely to actually go bust if the government don't intervene. So I believe the government is doing what they can with what they've got at the moment.
So you think the government is doing well? Would you say
they're doing what they can? They are doing what they can, but I don't feel that it's enough. But I think it's because this was sort of like, I wouldn't say sprung onto them per se, but I think they were not prepared. They were not properly prepared of how to of what was coming down when it comes to this COVID-19. So it's not being managed as well as we would like it to. I believe they're doing what they can at this moment in time. Yeah.
We had a discussion with somebody in Italy and I think in the US, and they talked about there is a bit of politics in all of this. Is it same in the UK?
Oh yeah, definitely, definitely. I mean, the thing is that no one we cannot please everybody. This is the thing. The government would you can try as much as possible, but they cannot please everybody. And some people are happy with the measures that have been put in place, and others are feeling that they've been short strawed. Do you understand? So even though some places are feeling like okay, it's okay, at least we're getting the 80% payment for our employees. Others feel like as though that 80% is not even enough because and that 80% there's a gap. There's a gap to it. There's a gap of 2,500. And once you've reached that, that's it. And some people could be earning much more. Some people that have been laid off could be earning much more. And that 2,500 may not be enough to be able to cater for their daily activities. So yeah, as for the politics of it, there's always politics on everything anyway.
Yeah, as often as possible, we'll reach out and then get to talk more with you and then find out and get updates. We are very grateful for your doors that you opened onto us. However, we will not just let you go. Which in Ghana, lots of people have not really seen it. They've just heard, and we barely see them on TV. So people doubt it. What would you say, or what are the few words that you would give to people in Ghana who still doubt the existence of this disease?
Guys, this disease is for real. It's happening. We are on the lockdown, and this lockdown means that our children can't even go out to play. We have to even plan when we're going to go and buy stuff, general things. It is extremely serious. People are dying left, right, and center. The numbers that are being mentioned are not fake. Coming from a nurses and health perspective, who works in the NHS, myself, it is something that is extremely scary. My colleagues are scared for their own lives. They are scared for their family's life. People have to leave their homes in order to be able to look after others. So I am pleading with you, if there are any measures that your country has put in place, please adhere to it. It's very, very important. I am pleading with you. Listen to those instructions. This coronavirus is not a game. It's not a joke. It is real. It is happening. Let's all please keep safe for ourselves as well as others. Thank you so much for your time.
Thank you very much. Just to let you know, it's sad that Ghana was on a lockdown as well when we had to lift it. I think the pressure is kind of too much, so it had to be lifted. So that was just by the way. Thank you very much for opening your doors to us, and we are hoping that we'll get in touch as often as possible, and our audience will be educated. Thank you very much, Joe, for your time.
You're welcome.
All right.
Bye everybody. Take safe. Keep safe.
You too.